Hello, and welcome to this month's Lunch and Learn on diabetes prevention through lifestyle. My name is Allison Knight, and I am the health coach for Employee Health Center. So, to get started, we need to talk about what is diabetes. Diabetes is a condition where the body either does not make enough insulin or it doesn't use the insulin that it makes properly, and that is called insulin resistance. There are three types of diabetes: type 1, type 2, and gestational diabetes, which is the type that affects pregnant women, some pregnant women. Type 1 diabetes is also known as juvenile diabetes. Only about 5% of the total diabetes diagnoses are type 1, and in this case, the body does not produce insulin. And because it does not produce insulin, the only management tool is actually insulin injections, since the body is not creating insulin itself. The more common of the types is type 2 diabetes, and this is a lifestyle-driven disease. It's usually resulting from diet and lifestyle factors. And in this case, the body does not use the insulin that it makes effectively for a few reasons. When the body isn't using the insulin effectively, whether it can't penetrate into the muscle cells due to a layer of fat, or the body isn't producing enough effectively or recognizing it, it can lead to pancreas cell death, and this damage is typically irreversible. Some people think that you can reverse diabetes, but it's virtually impossible except for potentially a pancreas transplant, which is something that's not very common and still is needing a lot of research in. But it can be managed, and you can live a healthy and fulfilling life with diabetes. Type 2 diabetes is typically treated firstly with lifestyle changes, as well as prevention is typically through lifestyle changes, then oral medications, and if necessary, insulin. Once you need insulin injections, it typically means that your body is no longer producing enough insulin, or your body no longer recognizes it. And so once you're on insulin, you're pretty much on insulin for life. Knowing the symptoms is important. So chronic fatigue, or always feeling tired, frequent urination because that body needs to excrete all that additional sugar in your blood stream, and it does so by having you go to the bathroom. Sudden weight loss and typically unexplainable weight loss. This is usually seen with type 1 diabetes because the body can't take that sugar in for the energy that it needs, and so the body is essentially starving. Wounds that won't heal are very slow healing. It can cause sexual problems. You are always feeling hungry, again, because your body isn't moving that energy into the cells, and so it feels like it's starving. Blurry vision because buildup of blood sugar can cause nerve damage, especially in those tiny blood vessels in the eyes. Numbness or tingling in your hands or your feet, again, causing nerve damage. Always feeling thirsty because of that buildup of the blood sugar and the constant going to the bathroom, as well as vaginal infections or other type of infections such as gum and tooth infections. So type 2 diabetes risk factors. There's some factors that we can't change, and there's factors that we can improve. Firstly, if we're 45 years or older, you typically have a higher risk for diabetes, and this is simply because as we age, our body systems start to decline. If you have close relatives with diabetes, you have that familial or that genetic factor that might just predispose you to a higher risk of diabetes. Gestational diabetes, if a woman has gestational diabetes while she's pregnant, she has a higher likelihood of then getting type 2 diabetes later down the road. High risk ethnic background, so certain ethnicities such as African Americans and Hispanics tend to have a higher risk of type 2 diabetes, though this might not be solely based on genetics, but on social determinants such as their socioeconomic status and where they live. And then other medical conditions. So certain medical conditions put you at a higher risk, but there are also medical conditions that you can control. So things that you can improve, managing or preventing high blood pressure and managing or preventing high cholesterol, which can include your total cholesterol, your LDL, that bad cholesterol that builds up plaque in our arteries, low HDL, which is the good cholesterol that actually removes that plaque from our arteries, and triglycerides, which are the free floating fatty acids in our bloodstream that are typically stored energy from a meal that we already used all that we needed at the moment. Maintaining a healthy weight. So if you have a high weight, whether you're considered overweight or obese on the BMI scale, your risk factor is increased. And having a low activity level or being more sedentary can also impact your risk. Long-term complications due to diabetes, again, include blindness because of those small nerves and the blood vessels being impacted by the buildup of blood sugar, kidney failure, those small blood vessels leading to the kidneys. Very often people who have diabetes end up on dialysis for their kidneys, nerve damage, sexual dysfunction. That nerve damage can then lead to issues with dental problems, disease, decay, can lead to amputation, which usually starts with, someone gets a cut on their foot, which they can't feel, it gets infected, it spreads, there's more nerve damage, and eventually the only option is to cut off the toe or the foot or the lower extremity. It can also lead to heart attack or a stroke, and it can also cause pregnancy complication. So lots of scary long-term complications if it's not diagnosed and if it's not properly controlled. So to check, we would do a fasting blood glucose. A normal blood glucose should be between 70 and 99 milligrams per deciliter. The pre-diabetes range, or at least the elevated glucose range, is 100 to 125 milligrams per deciliter, and a blood sugar over 126 milligrams per deciliter could be indicative of diabetes. However, more than one fasting lab draw would be needed to confirm a diagnosis of either prediabetes or diabetes. So looking at a blood sugar chart, again, a fasting blood sugar for someone who does not have a diagnosis of diabetes would be 70 to 99 milligrams per deciliter. And the official recommendation for someone who is managing their diabetes should have a fasting blood sugar of 80 to 130 milligrams per deciliter. 2 hours after a meal, someone who does not have a diagnosis of diabetes should have a blood sugar less than 140, whereas someone who is properly managing their diabetes should have a blood sugar less than 180. Now, a HbA1c is your hemoglobin A1c, and this is something that your primary care provider would probably do to determine whether or not you have a diagnosis of diabetes or if you have an elevated glucose. What this is a snapshot of what your average blood sugar has been over the past 3 months. It's looking at your glycolated hemoglobin, which attaches to or pairs with blood sugar, or the sugar in your blood. So if you have higher numbers of hemoglobin in your bloodstream or on your blood cells, that means that there has been a higher amount of sugar in your bloodstream. And vice versa. If there's less, that means there's less sugar. We want less because that means that there hasn't been as much sugar accumulating in our bloodstream. For the normal person without a diagnosis of diabetes, they want to see that less than 5.7. If it's slightly above that, that would put you in the elevated glucose or pre-diabetes range. And then the official recommendation for someone who has diabetes but is controlling it is less than 7%. So now that we know the what, the risk factors, the complications, the symptoms, now we're going to look at what can we do to prevent it. So the first thing that you can do is to maintain a healthy weight. Again, anytime we go into that overweight or obese category, we are at higher risk. But losing only 5 to 7% of your current body weight can actually dramatically reduce your risk of getting type 2 diabetes. You also want to look at maintaining a waist circumference under 35 inches for a woman or under 40 inches for a man. We look at waist circumference as a good indicator because if we have a larger waist circumference, it's typically indicative of a higher amount of abdominal adipose tissue, which is linked with an increased risk in many chronic conditions, including diabetes and heart disease. We also want to maintain a body weight percentage that is less than 34% for women and less than 24% for a man. Those are then putting that body fat percent into the obese and overweight categories and linking us to a higher risk of diabetes. So the first thing we want to look at is the diet, because this has a huge impact on our diabetes risk and our overall health. The MyPlate website is a great resource to find tailored meal plans, the serving size recommendations, the food group recommendations. They have recipes, all sorts of things, so you can visit them at choosemyplate.gov. For fruit, men need about 2 cups a day. An adult male over the age of 19 needs 2 cups a day, whereas an adult woman up to the age of 30 needs 2 cups, and over the age of 30 needs about 1.5 cups of fruit. So what is 1 cup of fruit? This is equivalent to about 1 small apple, 1 large banana, 32 grapes, 8 strawberries, or 1/2 cup of dried fruit. And this is because dried fruit is typically shriveled down, contains the same amount of nutrients as that whole fruit. 1 cup of 100% fruit juice would also be an example of a cup of fruit, but you want to remember that when we are drinking juice, we're removing the fiber, and fiber is one of the nutrients that can help prevent diabetes. And we're also looking at a lot of sugar all at once. Even though it's naturally occurring, there's still like 48 grams of sugar in an 8-ounce glass of orange juice, because you have to think about how many oranges were juiced in order to get you that glass of juice, versus you would only probably eat 1, maybe 2 oranges at one time. And even though it's naturally occurring, it's still going to cause a spike in our blood sugar, which isn't necessarily a good thing. For vegetables, adult men up until the age of 50 need about 3 cups a day. Over the age of 50 need about 2.5 cups. Whereas women up until the age of 30 need about 2 cups a day, and over the age of 30 drop down to 1.5 cups a day. 1 cup of vegetables is equivalent to about 2 cups of green leafy vegetables such as spinach, kale, romaine, arugula, 1 large 3-inch sweet potato, 1 large bell pepper, any color, 2 medium-sized regular carrots or about 12 baby carrots, and then 1 cup of beans or peas, and so this means legumes, chickpeas, lentils, and also your garden variety peas. For grains, adult men up until the age of 30 need about 8 ounces, then up until the age of about 50 they need 7 ounces, and thereafter need 6 ounces. Whereas women up until the age of 50 need about 6 ounces and thereafter need about 5 ounces. 1 ounce of grains is equivalent to 1 regular slice of bread, half of an English muffin, so eating the whole English muffin is 2 servings, 5 whole grain crackers such as Triscuits or Wheat Thins, 3 cups of popped popcorn, preferably kernels that you have popped yourself so that you control the amount of seasonings, salt, fat, oils that you put on it, and 1/2 cup of cooked pasta, rice, or oatmeal. You also want to try to make half of your grain requirement whole grains. So whole grains are going to be wheat, barley, rye, quinoa, brown rice, as opposed to refined carbohydrates like white bread, white pasta, white flour tortillas. Refined carbohydrates generally contain very little nutrition. If they contain any, they've typically been enriched, which means the things that are of value, the nutrients, have been removed, and some have been maybe added back in, but not necessarily in the same ratio they were, not necessarily the original nutrients are found in them. So going with the whole grain means it's been unaltered, it contains the original nutrition, and they're going to affect your blood sugar in a different manner. They also typically contain more fiber. The daily recommendation for fiber is about 25 grams for a woman and 38 grams for a man each day. 97% of Americans do not even get the 25 grams. And it's good to get in because it makes us feel more full. It takes longer to digest, so our stomach empties slower. We're satisfied longer. We aren't as hungry. So the soluble fiber that we can digest takes longer to digest. And then the insoluble fiber, which is mainly just feeding our gut bacteria, keeping us regular, keeping our GI tract healthy, doesn't actually get digested at all. And so this has no effect on our blood sugar. Whereas those refined carbohydrates are basically digested the same way as simple sugars, and they're going to cause a blood sugar spike and then a crash. So choosing those whole grains as much as possible. For dairy, basically adult men and women both need about 3 cups a day. We really want to go for more of those low-fat options if possible. 1 cup of dairy is equivalent to 1 cup of milk. 1 container of yogurt, which standard size is about 8 fluid ounces. 1/3 cup of shredded cheese. For some reason, 2 cups of cottage cheese is equivalent to 1 cup of dairy. And if you really need that sweet treat, 1 cup of frozen yogurt. So for yogurt, you want to try to eat plain yogurt because there won't be any added sugar. There'll be naturally occurring sugar. And if you really want to get bonus points going with a Greek yogurt, generally the way that Greek yogurt is cultured and processed, it contains about 6 to 8 grams of naturally occurring lactose, which is a sugar, in 1 cup, compared to 1 cup of plain regular yogurt, which is going to contain about 10 to 12 grams of naturally occurring sugar based on the way that it's processed. Not only that, but Greek yogurt also contains more protein, so it's a more filling food, and it also contains less sugar, naturally occurring or otherwise. Protein, adult men up until the age of 30 need about 6.5 ounces. Up until the age of 50 need 6 ounces, and over the age of 50 need about 5.5, whereas women up until the age of 30 need about 5.5, and then over the age of 30 need about 5 ounces. 1 ounce of protein looks like 1 ounce of cooked poultry, beef, or fish. It looks like 1 slice of deli meat, 1 egg, 1 tablespoon of peanut butter or other nut butters, 1/2 ounce of nuts or seeds, or 1/4 cup of cooked beans or peas. Remembering that you really want a variety of protein sources, so trying to incorporate those plant-based sources into your diet. They especially make good snacks because they're easy and they're usually non-perishable. And when you're choosing those other protein, animal source protein options, going with the leaner options like fish and poultry, or beef with less marbling, draining the fat as much as possible. Oils and fats, this is really more of a limit. So men up until the age of 30 should limit their oils and fats to about 7 teaspoons, and after that, limit to about 6 teaspoons. Women up until the age of 30 should limit their intake to about 6 teaspoons a day, and thereafter about 5 teaspoons a day. So what does a serving of oils and fats look like? So 1 tablespoon of vegetable oils contains 3 teaspoons of oils and fats, because 3 teaspoons is equivalent to 1 tablespoon. Whereas mayonnaise, for instance, 1 tablespoon of mayonnaise contains about 2.5 teaspoons of oils and fats. So it's mostly oils and fat. 4 olives contain 1/2 teaspoon of oils or fats. An avocado contains 1/2 avocado contains 3 teaspoons or 1 tablespoon of oils and fats, and 1 ounce of nuts contain about 1 tablespoon or 3 teaspoons of oils and fats. Typically, we want to go towards more of those heart-healthy fats, and so these are going to be more of those omega-3s, polyunsaturated fats, so olive oils, avocado oils, vegetable oils, olives, avocados, and walnuts and almonds in particular. We want to stay more away from the saturated fats that are found in plants or animal sources like meats and dairy, as well as The exception to the rule, the plant sources, which are palm kernel, and coconut oils. So even though coconut oil kind of was trending as being this heart healthy oil, it actually does contain naturally occurring saturated fat in it, which you do want to minimize in your diet. After the diet, we want to look at physical activity. So you want to increase your physical activity throughout the week. The daily recommendation continues to be a minimum of 150 minutes of exercise a week, which most Americans do not get. On top of building in actual exercise, you want to look at increasing movement throughout the day, because sitting for extended periods of time can also impact your risk of diabetes. You also want to make sure that you're including various types of exercise, so cardio, strength training, balance, and stretching exercises, to make sure that you're hitting all of the areas of health. Exercise guidelines, again, you want to work out 5 days a week or 150 minutes per week, moderate intensity of about 55 to 70% of your heart rate max. So take 225 minus your age to get your max heart rate, and multiply that between 60 and 70% to get what your heart rate should be when you're working out. Should try to hit flexibility training 3 to 7 times a week, cardiorespiratory training 4 to 7 times a week, core training 2 to 4 times a week, as well as balance training and resisting training also 2 to 4 times a week. Flexibility training, you want to warm up with myofascial release, so those foam rollers that you see, 30 seconds on the muscles. Also active isolated stretching, so this is 1 to 2 seconds for each exercise and about 5 to 10 reps. And dynamic stretching, 10 reps on each side, so arm circles, leg swings, step out lunges, basic jumping jacks, basically getting your body warmed up before you work out. And then static stretching, so the typical elbow behind the head stretch, or the quad stretch where you pick up your foot behind your glute. Those are static stretches you really want to do after the workout when you've already warmed up, because you're less likely to pull something on a warm muscle than a cold muscle. Passive is 30 seconds for each muscle, and then active is where you're engaging the other opposite muscle, 10 to 15 seconds for each muscle. Cardiorespiratory, the benefits are burning calories, curbing cravings, strengthening your heart and muscles, better sleep, and examples are jogging, step-ups, burpees, anything that gets your heart rate up. Resistance training is important because it improves that heart health, your bone density, your metabolism. It decreases your body fat and improves your coordination. You want to look at stabilization exercises, which are controlled and done on an unstable surface, like a busto ball or a beam or on one leg. And then strength, which is stable surface, and these are total body exercises that are multi-joint or single joint. Next, you want to manage your stress. This is especially important nowadays. We're really realizing the impact that stress can have on our physical health, not just our emotional and our mental health. And it's important to find ways to healthfully manage your stress. When we're stressed, our blood sugar increases, so we should try deep breathing, meditation, stretching, or other calming activities to manage it. It affects every part of our body. It affects our brain. It increases anxiety and depression and irritability, difficulty concentrating. It can increase our cholesterol and our blood pressure. It increases inflammation, so it increases aches and pains. It decreases your immune function, so it increases the risk of us becoming ill. It can cause brittle nails, hair loss, dry skin, or acne. It can cause issues with the gut, so nutrient absorption. It can cause diarrhea. It can cause constipation. And it can cause decrease in hormone production and decrease in libido. So it affects basically every part of the body. Some ways to healthfully deal with stress. Meditation. So I have 2 types here, the loving kindness meditation and the body scan. 2 different ways to help induce that relaxation in a healthy way, increase your mindfulness, become more in tune with your body, your feelings, your sensations, and promote relaxation. There's also deep breathing, which is kind of another avenue of meditation. We have the belly diaphragmatic breathing, and this is really using your diaphragm to breathe instead of your chest, which is shallow breathing. We tend to do when we're stressed out or overwhelmed. We want to induce that deep breathing. The 4-7-8 breath, which can actually help switch off that parasympathetic nervous response, that fight or flight response where our respiration rate and our heart rate increases. We want to turn that off. So you breathe in for a count of 4, you hold it for a count of 7, and you breathe it out for a count of 8. Breath counting is a Zen practice that's designed to bring your attention to your breath. You basically count to 5 with each out breath. So breathe in, breathe out, 1. Breathe in, breathe out, 2, up to 5, and then restart. If you find yourself counting up higher than that, you know you're really not paying attention. Sleep hygiene is also extremely important. Getting enough sleep. The recommendation is 7 to 9 hours. You want to create a good sleep environment. When we aren't getting enough sleep, our hormones aren't properly regulated, and insulin is a hormone. And we tend to have an increase in appetite and a decrease in satiety. So not only are we hungrier, but it also takes more to fill us up. So how is sleep directly related to diabetes? That insufficient or irregular sleep pattern throws our hormones off. And this causes less insulin to be released. More stress hormones are released, which means less insulin is again released and sugar starts to build up in the bloodstream, which increases the likelihood that we are going to have diabetes. Sleep deprivation, again, increases that appetite, and we typically go for things like refined carbohydrates and simple sugars because our body knows it's going to get that instant gratification that it wants and that burst of energy, but then we crash. And that decrease in satiety, so we have to eat more to feel full. And on top of that, it leads to lack of exercise because when you're tired, the last thing you want to do is exercise. Though, if you get up and you make yourself exercise, you are going to get that boost of energy and those endorphins, those happy hormones, and feel better. You don't want to do it too close to bed because you do get that boost of energy, but then it will help you sleep better later on. Sticking to a routine is necessary. Try to have a set bedtime and wake up at the same time, even on the weekends. This helps set your circadian rhythm, that internal clock that tells us when it's time to go to bed and when it's time to wake up. Again, exercising daily, especially moderate to vigorous exercise, can help you sleep better at night, but you want to avoid exercising too close to bedtime because it can make it harder to sleep. Avoid napping if possible, especially in the afternoon. If you're going to do it, you really only want to do it before 2 p.m., and you really only want to take a cat nap about 20 to 30 minutes. Once you go into more of that deeper sleep, if you wake up in that deeper sleep or are woken up in that deeper sleep, you are going to feel more groggy versus if you're in that light sleep, you can wake up feeling more refreshed. Get some sunlight. Using sunlight to wake up in the morning is the best way to help set that circadian rhythm, and trying to get outside and get some of that sunlight and that vitamin D can help improve your sleep and your immune system. Set the mood and get comfortable. So they suggest a cool, dark, and quiet environment. Try using things like earplugs, face masks, a sound machine, a fan, if anything, to help create that perfect sleep space. And also having a mattress and pillows that you find comfortable and supportive. The typical lifespan of a mattress is 9 to 10 years, and having that right support will help you fall asleep and also stay asleep and not wake up with like a kink in your neck. Limit alcohol, caffeine, and cigarettes. They all contain stimulants. It's best to avoid these as much as possible, but especially within the 2 to 3 hours before bed. Large meals can also make it harder to fall asleep, so try a snack 45 minutes before bed if you are hungry, and do something small. Avoid blue screens before bed. This is probably the biggest issue lately. Avoiding those bright lights before bed as they can confuse our natural sleep cycle. Blue light causes our brain to think that it's time to be awake. So the TV, the computer, your phone, the tablet, put those away at least an hour before bed. The sooner the better. And then create a relaxing bedtime routine that works for you. So again, turning off the devices, taking a hot shower, having a cup of decaffeinated tea or chamomile tea, Do some stretching, do some yoga, do some deep breathing, maybe read a little bit, listen to some calming music, do things that help you unwind in a healthful way. So to wrap up, we want to maintain a healthy weight or lose about 5 to 7% of our current body weight to decrease our risk. We want to eat a variety of foods and a nutritious diet like fruits and vegetables and whole grains and low-fat dairy and lean protein. We want to move more throughout our day because sitting is the new smoking and it can increase our risk of diabetes and other chronic conditions. And on top of that, we want scheduled, planned-in exercise of at least 150 minutes a week. We want to manage our stress in helpful ways like deep breathing, meditation, reading, and we want to prioritize getting good quality sleep to help prevent any further issues with insulin production. If you are interested in making a healthy behavior change, you can contact me using the information below. Thank you so much for joining me today. And our final Lunch and Learn of the year will be on fad diets and myths. And that will be in a couple of weeks. We will see you then. Thanks so much.